about the circle of willis. So circle of willis is actually, it is a ring of the arteries, and it is found at the base of the brain. Then the thing is, it is formed of two main artery. That is, one thing is in the internal carotid artery, and the other thing is this vertebral artery will join together to form the basal artery. So this system, that is vertebro-basilar system, will contribute vertebro-basilar plus internal carotid artery will form the circle of willis. It is forming in and around the interpedunclar fossa. Next thing is about the relation, that is anteriorly we will be having, as from this figure itself we can say, so anteriorly we will be having anterior cerebral and anterior communicating. Posteriorly we can see basilar artery. Till here we know the basilar artery will again split into posterior cerebral artery, which will form the posterior relation, and laterally on each side will be having posterior communicating artery. So these are the relation. Now we will see the functional significance. The significance is that because of this there is no little or no mixing of blood stream. Then the thing is, the major arteries are internal carotid and vertebro-basilar. So they make sure that the right arteries provide blood or supply blood to the corresponding side. That is, right will be providing to the right side, and left to the left arteries to the left side of the brain. Next thing is about if any block is there, then collateral circulation will come into play. Then the clinical relation is that first thing is about the aneurysm. Aneurysm means at the site where at the junction of two arteries, it can lead to aneurysm, or the arteries can get blocked and it can lead to aneurysm. So because of the characteristic shape of the aneurysm, it can be, because of the characteristic berry shaped, it can also be called as berry aneurysm. So there are certain important sites where we can most commonly see this berry aneurysm. The first thing will be no need to learn the percentage, but we should know that these are the important sites. The first thing will be between the anterior cerebral and anterior communicating at this side. The second thing will be posterior communicating and internal, this side, the internal carotid and posterior communicating. Then the third thing will be at the bifurcation of the middle cerebral. We know middle cerebral artery is actually a branch of the internal carotid artery. So at the bifurcation of the middle cerebral artery also we can see an aneurysm. Then the fourth thing will be at the basilar artery, because bifurcation of basilar artery means basilar artery is going to bifurcate into cerebral artery. So at that side, that is also a junction. So there also we can find aneurysm. So that is the clinical anatomy of circle of willis. It is very important enough to remember this figure, that is internal carotid, giving branch as anterior cerebral, then anterior communicating, then posterior communicating, posterior cerebral, basilar and vertebral arteries.